Hey there, Dr. Brian here. What's your risk of getting sick? We're going to look at this in reference to a Lancet article that was released last month. So if you want to find out some more, stay and I'll tell you what it meant, that article. Hi, Dr. Brian here. Now, I have seen quite a bit of advertising talking about the concept of a Lancet article just released in October, published in October, said that wearing a face mask reduced the risk of transmission by 70%, which I thought was interesting. So my analytical mind, I want to know what the study design is. How did they measure it? What were they doing to get to that number? Because a lot of the studies that I've looked at say that it's actually almost like a neutral to negative gain, because the use is inconsistent. People take them off, they take them off to eat, they take them off to talk, they're touching them, they're often uncomfortable for more than just a few minutes, so often touching your face and you're touching other things. So if the idea is to not move infection from an object to your face, having something over your mouth that means you're fiddling with all the time is problematic. And I've seen a study or just a demonstration on valutainment where they actually had a blue light looking at bacteria, and the water bottle was just disgusting, and after the mask had just been taken out of the packet and put on, it was already disgusting. So it really raised that was a very, if you like, graphic description, that there are a lot of problems with masks. So in a surgical situation, you scrub up for 5 to 10 minutes, you wash your hands, that's a lot of hand washing, and then you put your gloves on, you don't touch anything, it's a totally sterile environment, except there are people in there, and then you put your mask on, and it's often put on by an assistant, so you're not touching, the surgeon won't touch the mask, somebody else will do it for them. And then if they need anything, there's somebody to mop their brow, so they're not touching their skin or do anything. The rest of us, it's pretty potluck. However, I wanted to read the study and see how the study was designed and what they had found, because there's a lot of interesting data that would change, if you like, the validity of the statement. So, thank you to Google. And I found the Lancet article, and it was a Canadian article published earlier in the year in August, and then republished in the Lancet on the 1st of October. So the original thing was published in August the 3rd, I've got some notes down here, and then published in the Lancet on the 1st of October. So it's a long discussion. However, there's a few things I want to sort of tease out that help you to understand what that might mean for you, for, let's say, broadly, whether a face barrier actually truly reduces your risk of catching or giving a bug. So, because I was curious to know whether they actually had sick people, and whether they coughed or whatever they did or talked, and whether they actually could show some relationship between covered, uncovered faces and transmission, or whether they were asymptomatic people, or, who was the giver, who was the receiver, or did they just cough onto a bit of paper or onto a petri dish and then they cultured it. So, however, it turned out to be a literature review, so that means they just looked at lots of other research papers and then created a range of what's called relative risk. So I had to look that up because I did stats and I think I've forgotten too much. However, there's absolute risk. So the absolute risk could be that 1 in 100 or 1 in 2. So your absolute risk of dying when you jump off a 10-story building could be, 1 in 2 or 1 in 1. So everyone who jumps off a 10-story building dies. It could be 1 in 2 because half of them, get a soft landing, they land on someone. So then So that is not discussed in this paper. So there's no concept of absolute risk. But they talked about different environments which would seem to be heightened risk. So they talk particularly about healthcare workers looking after people who were acutely sick. So they're the people that actually get admitted to hospital who are properly sick, so they're not well. So they are the people every flu season that end up in hospital with breathing difficulties, with, you know, a high infectious load. So if they coughed and there was a spray, there will potentially be a spray of atomized saliva, and in the saliva there will be some bacteria, viruses, etc. And if you fell on your hands or on your face, or you were talking while they coughed, you might pick up some of that matter, and it goes into your mouth. And depending on your fitness, your body will either go, "Ha, I know what they are. This is a common cold variety. I know what to do. I've got T cells at the ready, and we're going to just mop this up in 2 minutes." And you don't even know that anything's happened. And that's the common experience, because everyone doesn't end up sick the next day and the hospital has to close because there's no workers left. So the absolute risk is probably, you know, in an acceptable range. Now, relative risk is actually a fraction of that. So what's the probability versus the possibility? So if the possibility is, say, 1 in 5, your probability could be 1 in 20, because you're super fit and you take vitamins every day. They may not, the health organisations might tell you that's an invalid thing to do, but you believe it's true, so quantum medicine would say it works. And so you're doing all the right things, and you're getting 8 hours sleep at the right time of the day, and you're eating green, and you never have sugar, and your system is 100%. So you can tend to the sick people and never get sick, like Florence Nightingale. However, if you smoke and you drink every night and you're highly unfit and you're only getting 2 hours sleep and you're wildly stressed at home and at work, you are more likely to get sick. So your relative risk could be, or your absolute risk could be higher. So the risk range for wearing a mask is between 6, or the relative risk reduction is between 6 and 80%. And they then went in and discussed that there was hard to work out what in the data, how they'd actually created their tests to give them a number. So that is a 72% range. That's huge. So where do you fit in that? I think that it's probably fair to say there's a discussion about proximity, duration, closed spaces, the things that we know that might increase your absolute risk of picking up any sort of bug that would be, say, airborne. You know, things like the AIDS infection, it needed to be carried on a bodily fluid and basically introduced into your body. So, needle sharing, unsafe sex, things like that were how you catch it. You can't get it off cutlery or a glass. So in that respect, we're looking at, if you like, a window of likelihood. Now, we know that the masks, the surgical masks that I bought for use in the practice, on the outside they say they are for pollen and dust, because they're bigger than a virus. A virus particle is similar to the same atomic size or molecular size as a smoke particle. We covered that when we were talking about smoke earlier in the year. So we're talking about a few microns, not a lot, quite tiny. You could not see it on a surface, you'd need a microscope. And even then you'd need to know what you're looking at. So a really tiny thing. So a number of people described a standard surgical or cloth mask is like hoping for a chicken wire fence to keep mosquitoes out. It's not likely. A droplet of, someone splashes water on your face, or someone sneezed at you and you had your mouth open, it's quite likely that that mask would create a barrier. It isn't to say that as the droplet of spit hit your face and hit the mask and it fractionated, that the virus wouldn't just keep going, because it's actually been put through a sieve and the smallest bits keep going, like you sieve the pips out of juice when you want to make a puree or something. So I think it's just quite important that we understand what the efficacy is and whether for all of us there's actually a risk factor. So what's quite interesting, one of the subsequent articles in the Lancet was actually talking about the fact that breathing with a mask is a very conscious exercise, and because the receptors in your nervous system, particularly receptors in the blood flow to the brain that are measuring your CO2 and your oxygen concentration levels in the blood, when the CO2 levels rise, which would happen if you are breathing in through a barrier, so when you breathe out, instead of all the CO2 going out, a certain amount stays in your mouth, and when you breathe in, you pull it back in again. So it doesn't matter whether it's covering your nose or your mouth. You'll tend to breathe a bit more through your mouth. And that means that you're now breathing in a CO2-rich environment, and we know that that's not good for the body, so that will make you a little distressed. It'll change your heart rate, it'll change your breathing rate, and it can create a sense of drowsiness or a headache or other things. Those are widely reported symptoms. And so we don't want to be as that unfortunate woman who crashed her car when she got a CO2 overload driving her car, passed out and had a fatal accident. So there is a downside to wearing a mask, particularly for a prolonged period. And to make it truly effective, it has to be such a tight fit that it will not fog your glasses. If when you're breathing, you're fogging your glasses, then it's not working, because when you breathe out, all your air is going up. If you're a virus spreader, it's going to go up and out and it's going to contact other people. If the virus is in the air in tiny droplets that you can hardly see, then you can probably suck it in through that air gap. So, you know, that's another thing I wanted to look at in terms of the study. Were they fitting them like a military grade let's say noxious gas mask, which is like a super tight fit, and it'd definitely leave a mark on your face when you took it off, like a face mask when you go scuba diving. So I hope that helps you. I'll put a link to the study in the description so you can look at it yourself. But it was interesting, in that follow-on article, they were saying that the mask creates a difficulty with breathing that helps people to understand the experience of people that have long-term difficulty breathing, like people that have angina, and that's actually a heart issue, but it does affect their breathing, and people that have chronic obstructive airway disease, CODE, and people that might have the lung disease you get when you've had like asbestosis. So those things would actually change the alveoli and the lung tissue so that you get quite poor oxygen exchange, and every breath is a difficult breath, and it makes breathing extremely taxing and tiring. So that's telling us that wearing the mask actually affects breathing and is not as efficient and makes the whole job harder. So a decision for you, I'd say that if you feel that you're not feeling well and you're going to be around people who you feel could be vulnerable, like people over 70 and 80 who aren't in good health and take medications, that is a multiplier effect. The data about that is unequivocal. If you take a handful of drugs from your doctor every day, you increase your risk. Now, if you're fit and healthy but take drugs, it's not as bad, but you're one of the people that potentially might have some long-term effect after you recover. So it's something to discuss with your doctor and work out what your risk factor is if in this environment the long-term outcome could be worse than the incident that you're trying to prevent by taking drugs every day. So that's my 50 cents worth. We can look at that more in the future if you want to know a bit more. I'm happy to dig into this a bit further. I do like reading research, and I'd love to help you understand better how to be super healthy. Super healthy comes from move well, think well, eat well, and hold a good spiritual space that is the overlay that keeps those other three elements of the triad of health in balance. There's no doubt that The quantum approach to health shows that if you believe and you have trust, believe that you can get better, you will get better way faster. And people that meditate get better 4 to 5 times faster than people who do not. So there's no doubt that it's powerful. If you want to know more, we will give you resources to point you at meditation so you can include that in your daily health routine. All the best. I look forward to seeing you soon. All the best.